Hello again. I'm accused by my detractors of blaming almost every problem and evil in modern life on immigration. After I pointed out some difficulties which have arisen from the increased number of female doctors yesterday, sexism has been added to the list of charges against me, which was already a long one, I'm sorry to say. Today I'm not going to lay the blame anywhere for the situation I describe, but I invite viewers to advance their own explanations for what is observed. I'm thinking now particularly of GPs and the problems which most of us have getting to see one. First, the way that it used to be. I'm describing here everyday life in a working class district of what is now East London, but was at that time Essex, namely Ilford in the 1950s. Remember, this is not some little village, but a densely built up area with a large population on the edge of London. At the time of which I'm talking, 65 years ago, say, anybody wishing to see their doctor simply went down to the surgery when it opened, and after giving his or her name to the receptionist, who was usually the doctor's wife, by the way, took a seat in the waiting room. That was it. It was that simple. Contrast this with the situation today, the so-called 8 a.m. scramble, just to try and book a telephone conversation with a doctor. The chances of actually seeing a doctor are in many areas almost non-existent. This is despite the fact that most health centres have a dozen doctors and as many receptionists working there. In the 1950s, you could also be sure of seeing the same doctor every time you went. He made house calls as well, what used to be known as the doctor's round. If you were too poorly or infectious to come to the surgery, he would come to your house. Oh, and emergencies in the night as well. I remember the family doctor coming out at 3 a.m. to deal with a case of whooping cough. I don't think I need to ask viewers to compare this seemingly idyllic state of affairs with modern Britain. It sounds almost like a fantasy. Surely it couldn't have been that good. Well, it was. A visit to the casualty department was a swift and stress-free experience then. The local hospital was King George's, which was then up on Eastern Avenue at Newbury Park. You turned up there and knew that they dealt only with things like broken bones or serious cuts, perhaps your deadly disease. Average waiting time, perhaps 20 minutes or half an hour at most. Again, I do not need to remind viewers how things have changed since then in what they now call A&E. Here then is a question. In the 1950s, the National Health Service ran as smoothly as one could possibly wish. There was no need to import foreign staff. Almost every doctor one saw was white British and had been trained in this country. There were some West Indian nurses, but they too had studied and qualified in Britain. There weren't all that many of them at that time. What has changed since those days? Why is the NHS in a permanent state of crisis and always on the brink of collapse? I'm genuinely interested to know if there are any other explanations apart from what seem to me to be the obvious ones. I'm afraid that blaming the Tories won't really work as an answer. The time of which I was talking earlier was when Churchill was Prime Minister, followed by Anthony Eden and Harold Macmillan. These were, of course, all old-school Conservatives. Our Prime Minister is now suggesting that receptionists should be able to diagnose the needs of patients and decide if they really need to see a doctor. This is a truly terrible idea. I don't know what other people's impressions are of the receptionists at their local health centre, but the woman I usually encounter at mine puts me very strongly in mind of Mrs. Scrubbit from the Wooden Tops. The idea of her assessing the medical needs of patients fills me with horror. As for allowing the local chemist to prescribe antibiotics and so on, this too is an appalling notion. One of the reasons that we only let doctors prescribe antibiotics is because if people take them too widely, for every cough and cold, then we will see the emergence of antibiotic-resistant strains of bacteria. This is already happening. If you allow antibiotics on demand, then this process will accelerate. So, is anybody able to explain, without mentioning either immigration or part-time working and the increasing number of female doctors, what has happened to the health service to cause it to reach such a state? It's a bit like the old radio program, Just a Minute, only instead of avoiding hesitation, deviation, or repetition, viewers must avoid only the two subjects which I mentioned and see if they can explain what is going on without recourse to either of them.